Welcome to Back in Motion Health Talk, real talk for real results. I'm Dr. Justin Walbom, and today we're setting the record straight on chiropractic care. You've probably heard some things, maybe from friends, family, or social media about what chiropractors do and what they don't do. And a lot of it is flat out wrong. Today we're going to bust through the top chiropractic myths I hear all the time and explain what chiropractic really is, how it works, and why it might be one of the most powerful tools for improving your health. Well, let's start with the classic. All chiropractors do is crack backs. Look, I get it. If all you've seen is a viral adjustment video on YouTube or TikTok with a dramatic pop or crack, it's easy to think that that's all we do. But chiropractic is so much more than that. What we really do is assess and restore joint function, nerve flow, and movement mechanics. That crack or pop is just a byproduct of restoring motion to a joint that's locked up or has abnormal mechanics. It's not the goal, it's just part of the process. So at my clinic, we don't just adjust. We use nerve scans, decompression, laser therapy, therapeutic dry needling, instrument-assisted soft tissue mobilization, massage, corrective rehab, and more to fix the root issue. So no, we're not just back crackers. We're movement specialists. Myth 2, and this one might be the most common. The myth is, if I start chiropractic care, I'll have to go forever. But here's the truth. You don't have to do anything. Many people choose to keep coming, just like you keep going to the gym, the dentist, or your mechanic. Why do we do these things? Well, because it helps them stay ahead of the problem before it starts. At Back in Motion, we give patients a treatment plan that has a beginning, a middle, and an end. Our goal is to correct the issue, restore the function, and give you tools to stay well. After that, if you want to continue with occasional maintenance, great. If not, no pressure. This idea that we trap people into endless care, that's not how we do things. And honestly, it's not how good chiropractors work anywhere. Myth 3, chiropractic isn't based in science. That is outdated and flat wrong. There are hundreds of peer-reviewed studies showing chiropractic's effectiveness for low back pain, neck pain, headaches, and even improving nerve function, neuroplasticity, and range of motion. For instance, in 2023, there was a study published in the Journal of Orthopedics and Sports Medicine that compared chiropractic spinal manipulation to conservative therapy for low back pain and found that chiropractic care was significantly more effective over a one-year period. We also use EMG nerve testing, digital posture scans, outcome measures to make sure that our care is measurable and modern. So yes, it is backed by science and we have the data to prove it. So myth 4, it's dangerous. Well, the fact is that chiropractic is one of the safest forms of conservative care available. The risk of serious injury is extremely low, far lower than taking anti-inflammatory drugs or undergoing spinal surgery. We're trained to recognize when to treat and when to refer. We review imaging, assess red flags, and work with other providers when necessary. And honestly, if chiropractic were truly dangerous, malpractice insurance for chiropractors would be sky high. But it's actually among the lowest of all healthcare professionals. That should tell you something. So it's time to talk about one of the most misunderstood and misreported topics as it relates to chiropractic safety. And that is this: can chiropractic adjustments cause a stroke? This is one of those questions that usually comes from a place of fear, often fueled by media stories that go viral without all of the facts. So let's break it down into what we actually know from research. The concern revolves around a rare type of stroke called a vertebral artery dissection. That's when a tear occurs along the lining of an artery in the neck, which can lead to a stroke. Some media reports have suggested that neck adjustments cause these strokes, but what the research actually shows is that people often experience neck pain and headaches as early symptoms of a dissection. and that dissection is already in progress. These people then visit a chiropractor or a medical doctor for relief after the stroke process has already started. This has created the illusion of causation when it's actually correlation. So what do the studies actually tell us? Well, let's look at the evidence. A major study published in Spine 2008 compared visits to chiropractors versus medical doctors before vertebral artery stroke and found that there was no increased risk from chiropractic care compared to primary care physicians. So the conclusion is what? Well, seeing a chiropractor was no more likely to precede a stroke than seeing a medical doctor. In 2021, a systemic review published in Chiropractic and Manual Therapies reaffirmed that causation has not been established, and most cases linking stroke to chiropractic care are temporally associated but not caused by the adjustment itself. So is it safe? Yes, the risk of having a stroke following a chiropractic neck adjustment is estimated at about 1 in 5 million adjustments. To put that into perspective, you're statistically more likely to get struck by lightning, take serious side effects from an NSAID, or have a complication from routine neck surgery. At Back in Motion, we follow clinical best practices, screen patients carefully, and always err on the side of safety. If someone presents with unusual or stroke-related symptoms, we don't adjust, we refer fast. So this myth has scared a lot of people away from getting care that could truly help them, because of sensational headlines and not solid science. As with any healthcare decision, you deserve informed consent, honest risk assessment, and providers who prioritize your safety. That's why we and most chiropractors do this every day. So, if you've avoided chiropractic because of this myth, I encourage you to come in and have a conversation. Get the facts, not the fear. So, the next myth is that chiropractic doesn't help with anything except back pain. And this one is a little frustrating. Chiropractic only helps with back pain is a fairly common sentiment out there. And yes, we do help with back pain and we're really good at it. But what we're really treating is not the pain, we are treating the nervous system. When nerves are irritated because of poor joint function, disc pressure, inflammation, it doesn't just cause pain, it causes dysfunction. We've helped people with headaches, neuropathy, balance issues, shoulder dysfunction, hip pain, irritable bowel syndrome, reflux, and more because they were caused by nerve or movement issues. Chiropractic care is about optimizing how your body moves and how your brain and body communicate. That affects more than just your back. So, you might be wondering, where did all of these chiropractic myths even come from? Why do so many people still think that chiropractic isn't scientific, isn't safe, or is some kind of fringe healthcare? Well, buckle up because this part of the story goes deeper than most people realize. Let's rewind back to the 1960s and 70s. During that time, there was a coordinated effort led by the American Medical Association, or AMA. It was to undermine and discredit chiropractic. This wasn't just professional rivalry, it was strategic, aggressive, and ultimately illegal. In what became known as the Wilk versus AMA case, a group of chiropractors sued the AMA and several other medical groups for what was essentially an anti-competitive conspiracy. The AMA had created a committee whose sole purpose was to, quote, contain and eliminate chiropractic. They told medical doctors not to associate with chiropractors, discouraged referrals, and launched a campaign to paint the profession as unscientific and even dangerous. For nearly 2 decades, this campaign shaped public perception and limited collaboration and planted seeds of doubt that still linger today. Here's the kicker. In 1987, a federal judge ruled that the AMA had violated antitrust laws and had engaged in an unlawful conspiracy to destroy the chiropractic profession. The chiropractors won, and the AMA was forced to issue a public retraction. Now, this was a turning point, but the damage was already done. Many of the myths people believe today, whether they realize it or not, are left over from that campaign. So the good news is that we've come a long way since then, and today chiropractic care is included in military hospitals, professional sports organizations, Medicare, and is backed by a growing body of research. But we're still cleaning up the mess from decades of misinformation, and that's why conversation like this one matter. If you're a patient who's been hesitant because of something you heard years ago, or a provider who was taught chiropractic isn't real care, or that chiropractors aren't real doctors, I encourage you to look at the evidence, look at the outcomes, look at the patients whose lives are changing every day. Before we wrap up today, I want to give you a quick preview of what's coming up on Back in Motion Health Talk in weeks ahead. We're not stopping at myth busting, and in fact, we are just getting started. I'll be bringing in guests from across the healthcare world, physical therapists, orthopedic specialists, neurologists, and even patients who've made remarkable recoveries. We'll talk about the big picture of conservative care, where chiropractic fits in, and how we can better serve our patients. We'll cover topics like how chiropractors and surgeons can collaborate instead of compete, understanding neuropathy from a multidisciplinary perspective, when to refer and when to adjust and when to do both, and even dive into hot button issues like opioids, imaging overuse, and why so many patients fall through the cracks of the traditional healthcare model. So, whether you're a patient, a provider, or just someone who's tired of living with pain and not getting answers, you're going to want to stick around. Be sure to subscribe, leave a review, or a comment down below. And if there's a topic or guest you'd love to hear from, shoot me a message at Dr. Walbum at backinmotionbr.com or DM us on Facebook. Thanks again for joining me. I'm Dr. Justin Walbum, and this is Back in Motion Health Talk. And until the next time, stay healthy.